Hello everyone and welcome to week number 4. So this week we have 2 chapters that we're going to discuss, but as always it's not the entire chapters. We will have chapter 33, pages 705 to 721, and chapter 38, pages 858 to 873. Chapter 33 will discuss the reproductive system for females, and Chapter 38 is about assisting with reproductive and urinary specialists. So let's go ahead and get started with Chapter 33. So Chapter 33 is discussing the female reproductive system and what it consists of. The female reproductive system consists of primary sex organs, the ovaries, and the accessory organs, which include the uterus, fallopian tube, vagina, vulva, and breasts. So let's go ahead and take a look at each one of those individual organs separately. So the ovaries are two little almond-shaped items. Each woman has 2 of them in their reproductive system. They are located on either side of our uterus, and the ovaries have 2 main functions. First function is to produce an ova, or an egg, and the second is to produce our female hormones. The uterus is a hollow, hair-shaped organ that is located in the front of the pelvic cavity, just above the bladder. Our uterus has 3 main functions. First is once a month it goes through what we call menstruation, or the discharge of blood, and the shedding of the uterine wall. 2, it provides nourishment and protection for a fetus when we're pregnant. And number 3, during labor, it contracts to help birth the baby. Your fallopian tubes extend from each side of the uterus and bend inward toward the ovaries. And their main function is to move the egg from the ovary to the uterus to help with conception. Each tube is about 4.5 inches long and only about 1/4 inch thick. So it's very tiny. They're not very thick, but they do have a little bit of a longer length. Next comes the vagina, which is the tube that is composed of muscles and membranes. It extends from your uterus and is typically about 4 to 6 inches long. The vagina has 3 main functions. Number 1, it is the organ of the female copulation, or obviously our sex organ. 2, it is the passageway for discharge during menstruation. And number 3 is the passageway for the birth of a baby during delivery. Your vulva is another organ that we have, and it's actually made up of 5 different organs. Most of them are external, which are your mons pubis, labia minora, labia majora, vestibule, and clitoris. And last but not least, we have our breasts, which are 2 rounded structures made up of fatty tissue that protrude from the chest. Each breast has numerous glands within it that form 12 to 15 tissue lobes. And when you're looking at the breast, the areola is the dark, pigmented circular area of the skin found on each breast. And in the middle of your areola is the nipple, which is the elevated area in the center. Alright, so now we're going to switch to chapter 38. 33 was pretty much talking about all of the female organs and sex organs. 38 is going to be talking about gynecology. Now, gynecology is the branch of medicine that deals with disorders and diseases of the female reproductive system. So what will happen is it will look at things such as your menstrual cycle, breast exams, pelvic exams, and prenatal care. Typically, when you go in to have a breast or a female reproductive exam, it does typically just consist of breast and pelvic exams. But if you're having difficulties with the menstrual cycle or prenatal care, that they can also take care of that in gynecology. So let's go ahead and break these down and take a look at them. The first one we're going to look at is your menstrual cycle. Now, obviously, most women know that a menstrual cycle is when we actually start having that regular bleeding once a month. When you typically have your first onset of your menstrual cycle, typically around puberty age, which is 12 to 13, we use the medical term menarche. That just pretty much states that you're now starting your menstrual cycles. Typical menstrual cycles are about 28 days long, but they can last up to 35 days. A cycle does not just include the actual bleeding portion of a menstrual cycle. It has 4 different phases that it will go through. The menstruation phase, follicular phase, ovulation phase, and the luteal phase. So the menstruation phase is actually when you're having that active period bleeding, or the actual shedding of the uterine wall. That typically can last anywhere from 4 to 6 days and can have side effects such as menstrual cramping, fatigue, and pain. The follicular phase is where you start to have that thickening of the endometrium, and that typically takes place about the 5th day of the cycle and lasts till about day 14. So days 1 through 6, you're having that menstruation phase. Day 5 through 14, you're having the follicular phase. Then comes your ovulation period. And during ovulation, the egg is made and then released into that fallopian tube. The fallopian tube will then carry it down into the uterus and wait to see if it will be impregnated. And the final phase is what we call the luteal phase. And this is when your body produces progesterone levels, and they're typically at their highest at this point. Now, another term that we use in the medical world when we're talking about the menstrual cycle is the term metrorrhagia, which means you have a bleeding between your regular monthly flow. Another term we use is amenorrhea, which means an absence or a lack of your menstrual cycle. This is typically when you're going in for your first prenatal visit. We call it an amenorrhea visit because you haven't had that menstrual cycle. The breast exam, this is to help detect any sort of breast cancer. Now, if the patient is in the office, they will lay on their back with one hand behind their head. This allows your physicians to examine the lymph nodes under the armpit as well as in the breast tissue. The same can be said if the patient is at home doing a self-breast exam. We will typically tell them to lay on a hard surface such as their bed, but we also tell them that the best place to do this is in the shower in the mornings, excuse me, when they're actually soaked up. It tends to be a little bit more relaxing for the patient to do that then. Another way that we can help kind of prevent sort of breast cancer development or any other sort of development is having mammograms. Typically, women will start having these after age 40. The clinical breast exam is when the patient will actually come into the office for their yearly physical. We start these typically in the 20s and 30s. And the last piece that we have is self breast exams. We really start telling patients that they should do these in their 20s, and that's recommended by the Cancer Associations of America. We typically tell patients that they should perform these every month, about 1 week after their menstrual cycle starts. Then we have our pap smear or pelvic exams. When we do these, a pelvic exam is both internal and external. And what that means is that we'll have a pap smear and a cervical cancer screening. A pap smear is part of every routine physical exam. And what we're looking for is cervical cancer or STDs. The most common STD that we see now is called the human papillomavirus, or HPV. And what that is a group of more than 100 different viruses that can cause cervical cancer. When a patient has an abnormal Pap test, the provider will typically perform what is called a colposcopy, which is where they actually take a biopsy of the uterus and the uterine wall to visualize and see if there is any cervical cancerous tissues. Now, as medical assistants, you're going to encounter a wide range of patients while you're working in gynecology. This is one of the most widely seen exams that we do, but one of your tasks is really to help kind of identify the patient's problems and provide that information to the patient. So it becomes very important when we move into prenatal care that you are able to prepare the patient for different exams and help to kind of explain all procedures to them. Prenatal care is what we give to people when they've become pregnant before they actually have the childbirth. One of the important things that our job as medical assistants and providers is to do is to actually figure out what the due date is. And in order to figure out the estimated delivery date or due date, we use what's called Nagel's rule. Nagel's rule uses a formula that takes your last menstrual period and you add 7 days to that. Then you will take away 3 months and add 1 year. Don't worry, in your lab classes, I'm sure you will be working with this, and there's great examples in your books as well. When you're explaining to pregnant ladies and women about maintaining a healthy lifestyle, please make sure that they understand that they should not be smoking or drinking alcohol. Certain medications should be stopped because it can be detrimental to the infant. And a normal pregnancy is about 40 weeks, but after about 36, the patient can go at any point in time. Alright guys, that is really all I have for this week's video. As always, please make sure that you're reading your chapter pages fully so that it will help you be prepared not only for your lab class this week, but also for your discussion post and quiz. Your discussion post for this week is going to be discussing high-risk pregnancies. And when we talk about those, does age really matter when it comes specifically to our female reproductive systems? You will need to discuss why conception after a certain age is considered high risk. And this can be really important, especially as we move into an age where patients are becoming pregnant at an older age instead of the younger ones. So please do some good research on that. Please make sure that your initial post is completed no later than Tuesday, October 25th by midnight, and that you have at least one discussion reply post to a classmate no later than Saturday, October 29th. You do have another quiz this week, and it will be over the female reproductive system. Your quiz will include 10 multiple choice questions with a 10-minute time limit. This quiz will be due Sunday, October 30th by midnight. Lastly, this week you will also see that you have a student survey. I would really appreciate it if you guys would take just a few minutes and give me feedback and give all of us here at Rasmussen some feedback. It helps us to get a better opinion of all of the concerns or maybe things that you see or things that are going really well that you want to kind of commend someone on. So please make sure that you give your opinions and your feedbacks. Please know that this is anonymous and I will have no knowledge of who says what or who turns one in. Your opinion does really matter to us here at Rasmussen, so if you could just take that few seconds and fill that out, I would greatly appreciate it. Alright guys, that is all I have for you. I hope that you all have a wonderful and happy week 4, and I will see you next week. Bye-bye.